Hello everyone, welcome to the channel MatDex with Hussain Abbas. So far we have discussed about the part 1 meta-analysis video. I would provide the link in the description below. Now moving forward from where we have stopped the last video. Okay, so where we have to study about the statistical analysis. Let me show in the Microsoft Edge browser. Yeah, so here we are discussing about the statistical analysis. So what is statistical analysis? You have to run the meta-analysis on any of the software. Like here would be mentioned which software and which model they have used for statistical analysis. Okay, so statistical analysis here is used on the Jamovi software program. Okay, they have mentioned the version and R Metaphor package. Okay, so there are two softwares which are used in this analysis. Here they mention, and the treatment effects were synthesized through pairwise randomized control trials and these things, and they have mentioned all of them. Okay, 95% confidence interval. They are also mentioning all of the things before the pool value has shown to you. And there is another thing which we would follow Cochrane recommendation. So there is the you have to mention that you have follow all the guidelines as well. What is I-square? I-square is basically the heterogeneity of the study. We show three different values. What is shown they have mentioned here. So this is the last part of methodology section, statistical analysis. What so far you have done in the statistical analysis of that study. Okay, now what you get from the study, you have to mention them in result section. So first of all, in the result section there is a study selection. Study you have the systematic search found 225 records. Okay, what I am saying in the previous video, that Prisma flowchart is mentioned somewhere, and where it is mentioned in result section. In result section you would rather make a heading of the study selection or the search strategy, and you have to mention this Prisma flowchart, this Prisma flowchart here in the study selection criteria. So what you have mentioned, you can already write them in the wordings. It is very easy. Like you have here as mentioned 225 records, out of them animal studies is removed, out of them duplicates is removed, 40 duplicates are removed, and this. After that you have the study wrong population is removed. After that you got just here 3 articles. Okay, here is mentioned as mentioned earlier, there would be the 3 RCTs, and these also all follow the Prisma guidelines, and these are the guidelines for the meta-analysis, and the chart is called Prisma flow chart or Prisma flow diagram. Okay, so you are seeing the paper that the paper has mentioned into subheadings. So it is good to mention subheadings, and it is easy for the reader to find a particular specific thing if he or she is finding for his or her research work. Okay, so it is very easy for the reader's perspective view. Characteristics of the included study. What are the characteristics? So this paragraph is written. So this paragraph is written from the extraction file. What we have so far found in extraction file, you have to write them here in this paragraph. So what is the characteristic of study? As there are 3 studies, so these are very low, so you can all mention them. I would likely to highlight from the other color. Like this is the study 1, and there are 7,500. So you can mention that. If there is anything else, you can also mention there. Like if there is something else, like 25% patient lost the follow-up. So this is unique. Okay, so you can mention here as well if the study is included in your inclusion criteria. After that there is another study and the same author but different here, third one study. Okay, so here you can mention the characteristics of all of the studies. Now talking about risk of bias assessment. Okay, as it is mentioned in the previous video as well, you have to mention the risk of bias assessment. Like here they use the ROB2 scale, so it is an analysis portion, separated analysis portion rather than the study analysis, which is trying to evaluate about what is the profile, what is the domains as mentioned earlier in the previous video. There are 5 domains. Let it be shown again. Okay, this one. So there is a Cochrane tool risk of bias assessment ROB2 scale tool which is trying to evaluate about the included studies. What the studies you have included, you have to mention. You have to check whether the study has has the safety profile, whether the study has any internal deviations, whether there is a missing data as well, if there is any encountered biasness you can also. So these are the two this is the tool which is checking the evaluation, which is which is evaluating the study. Okay, so this is the simple point. Now what you get, you have to mention in the result section. The included trials achieve high methodological quality, so you have to mention them. The majority In the majority of study domain assessed across all the result studies reviewed low risk bias. Okay, so biasness was low because the study used effective randomization method. So randomization is basically the patient does not know about what they are receiving, either intervention or comparison. Okay, so that makes the study reliable. So there is not biasness from the patient side or from the doctor side. There is high risk domain rating because researchers failed to report all safety outcomes. Okay, in the mentioned randomized control trials, researchers have does not mention about the safety profile completely. So that would be like a negative point when you are assessing the included studies. The study's remaining domains and all other trials showed low risk, which established analysis reliability for pooled data. Okay, so when the study like pass from the ROB tool, then it is going for the analysis. Okay, analysis not done before the ROB tool. Okay, so some author or one or two author are doing a ROB analysis. After that, the study's main analysis has been done. Okay, so remember the point. Now come to the main thing, which is the meta-analysis, which is the thing which we are discussing, and what are the forest plots and what are the study tables and how to read the forest plot. These all are discussed in this video. Okay, so this is the main objective of this video. Okay, let me take a sip of water, please. The weather is not fine here. Okay, so meta-analysis of the primary outcomes. So what are their primary outcomes? Their primary outcome is efficacy, and in efficacy there is subgroup, best overall response, and the other one would be, okay, there is only one subgroup and which is about the best overall response. Okay, so what you have so found in the study, you have to write in the result portion. Let me first of all check the forest plots. So this is the forest plot. Okay, so first of all you see the forest plot, and if you are the beginner and you are like, oh my god, what the hell the thing is. Okay, and what the diamond is, what the square is, what are these lines, and what this thing. So I will explain it to you one by one. Okay, so first of all, let me first of all discuss about this forest plot. So this is the center of line. Okay, and this vertical line is the main point, which is the reference point. Okay, so beyond the reference point there are something written like which would favor the experiment and which would favors the control, basically which are in the favor of intervention, which is in favor of nivolumab based drug, and which are in the favors of comparison or comparator arm. Okay, the small square show about the single study. Okay, it would tell about the study weight. The greater the square, the greater is the weight of the study in that analysis. The greater it has a sample size. Like this square, like here theory entry. So this is the study theory entry, and check the square of it. And to check the square of this theory entry, it has a weightage. And like yes, this is study one. I would highlight in rather in different color. Alina Els So this study and the square you see can see that how much a small square, like the weightage or the sample size of the study is very low as compared to this. Okay, so this study is important in your analysis group. So there are subgroup analysis like here, and there is a total one. Okay, so here in this complete response there is only one study which is applicable out of 3, and there would be the complete analysis or the super result. And you can see that here the diamond which is the main result of all the subgroup analysis has shown, and the diamond size is automatically or the proportional to the sample size. If the diamond touches the line, the result would be non-significant. Okay, and you can see here from p-value, diamond touches the line, and the length of the diamond from this point to this point shows about the confidence interval 95%. Same as for this point to this point shows the confidence interval 95%. Moving forward for partial response, here you see that in the partial response, I would likely to highlight it in another color. So in partial response, you see that the diamond is on the control arm, okay, favors the control arm, and it is not touching the line. So here the result would be significant. Okay, what is I square? I square is heterogeneity, so there is no heterogeneity among these two studies. Okay, among these two studies, and there heterogeneity is not mentioned because it is only the one study. Talking about the stable disease, okay, so it touches the line, it also touches the line, diamond touches the line, so it would be rather non-significant. And I square is low heterogeneity. Then come to the progressive disease. Here the diamond's length is long as compared to other one. There is a, and you can see that 0.41 to 1.1. That is telling about the length of the diamond. And diamond as touching the central or reference line, it would be rather p-value which is non-significant. Okay, so that is not in your head. If you are saying that our all results are non-significant and you are said, okay, so we have lost the meta-analysis. No, it is not necessary that your analysis will be in always positive direction. It would rather be a non-significant. So you have to mention the analysis. You are not supposed to here to incorrupt the data. Okay, so you are telling about the new drug which is the nivolumab, and you are telling the perspective, and your perspective you are taking all of the study, all of the database, and you are putting them into the analysis. You are handing to the analysis software like here Jamovi software or R software, and after that you are getting the results. So it is simple. What you get the results from that your analysis, you have to mention that. Okay, and after that your diamond of all the subgroup analysis, you have to mention them, and the final super result, and the super result is here. Okay, so heterogeneity is moderate, you have to mention that p-value is not significant, so heterogeneity is very high. There is one thing which is called meta-regression. So meta-regression is run on the analysis when there is high heterogeneity. Like here you can see the heterogeneity is high, moderate to high, from 56 to 66%. So you have to run the meta-regression. Okay, so we are talking about the meta-regression, but the point is that you must have the RCTs, you have a population greater than 2500, or you have the RCTs greater than 5. After that you can run the meta-analysis regression. In meta-analysis regression or meta-regression, you just skipping those studies which are creating the high heterogeneity, and that is done on the software. Okay, so this is the point I like to mention here. So what you can say that what you get from the study, you have to write it down. Okay, so you write it down in the way that you have to write the relative risk, you have to write the 95% confidence interval value, and if there is an I square value, and if there is a p value. Okay, this is done for all of the subgroup analysis, like what you found in complete response rate, what you found in partial response rate, all of the results you have to mention. All of the subgroups you have to mention that results. Okay, so these are the hepatic toxicities you have to mention. Okay, so in the manuscript, in the final manuscript, you may not see all of the forest plot, and you might ask like where these values come from. It might their forest plot might not be given. So that was in their supplementary file. There is a somewhat journal to journal vary, but there are 4 to 5 permission to insert the figures tables, forest plot, which is total about 4 to 5. Beyond this, you have to mention them in supplementary file. So next time you are seeing the new values, you have to check the supplementary file as well. There is another forest plot, and you can see how the confidence interval length is there. Okay, touching the diamond, touching the reference point, these studies you can mention. You can all of the see, and you can easily write the forest plot. You can also write for a single study like treatment related adverse effect or treatment related death. You have to mention how many studies you have written. You have to mention about the diamond. You have to mention about the confidence interval, and these are the total value. You have to choose this I value, and you have to choose this p value. Okay, same is written for all of the studies. Now come to the discussion. Okay, this is looking very bad. Let it be removed. Okay, so come to the discussion part. So what is discussion? Okay, discussion is the backbone of your meta-analysis. The good the discussion, the higher chances of your study get to be published or in the good journals, or get to be the chance to be more cited. Okay, so discussion is the main thing, and it is written by one of the author which have experience in writing the discussions. Most of this is written by the professors as well. So here we would likely try to understand about the discussion part. So discussion part is that in which you have to mention first of all what is the disease, and you can here you can mention from your introduction as well. So here you are trying to write something like introduction after interpreting the results. Okay, so you have taken the randomized control trials and you are mentioning them, and after that you can mention also them in and paragraph and subheadings as well. Okay, although the direct evaluation of triple immunotherapy combination was beyond the scope of this study, and what you have found you can mention here as well. So in discussion there would be 4 to 5 I'm sorry. So in discussion here the point is that you have to write 4 to 5 paragraphs, or it would be more than 4 to 5 paragraphs, and here you have to mention about what is similar to your introduction but interpreting the results. So discussion is the second name of your introduction but with the results, what you have found in the results. Okay, so in discussion paragraph like here, the author mentioned about interpretation of efficacy finding. What you have found in efficacy in your results, you have to write them in paragraph form, and then you compare if there is another study, and you have to mention them. Okay, like here must be a comparison of the study, like here are the references. So here must be the study which is comparing, like if the results are in the favor of the previous study, you have to mention, or in opposite or in the contrary, you have also mentioned them. And same is going for all of the things. Okay, so you have to mention the efficacy, you have to mention about the safety outcomes, and then other is the molecular context. So talking about molecular context, if there is another trial, like here mentioned Checkmate 142 and Niche trial. So these are the trials which are talking about the molecular contents. Okay, so you have to discuss them in your discussion part as well. You can rather give a hint or write a few sentences in the introduction, but you have to discuss them in discussion part. Remember, discussion is about what the reader is trying to perceive from your analysis. So it is not analysis, but it is what it is also the suggestions you are providing in this study. You are providing the future gaps, you are providing the future's perspective as well. So you have to mention them in discussion portion. Okay, here the author is trying to conclude that current data show what the current data show. They have mentioned that yet the evidence remains unclear. Okay, after doing the analysis, evidence is also remains unclear for this metastatic colorectal cancer, and then you can giving the future perspective as well here in this paragraph. So you are seeing that the forest plots are mentioning after like you are mentioning after some paragraphs as well. So these are formatting which is done or which is said by the journals editorial board to you when you are submitting the article. And then again in discussion portion efficacy has been done, and then about talking about the safety. Clinical implications. What are clinical implications? It is obviously about the immune checkpoints blockers, which is nivolumab, which is our intervention. Okay, so you have to mention them as well. Discussion is the thing which you can learn by the time, by the practice. You cannot write the full and final discussion in your first draft. You have to write it repeatedly. You have to take the steps to write the discussion, and you can write, as I said, discussion in one flow as well, but you can also mention them in subheading, so it would be rather easier. And after that you have to write a conclusion, what your study has concluded. This updated meta-analysis, okay, have shown about the significant benefits, so you have to mention them. And if there is high heterogeneity, so you have also mentioned that. And what you would likely to say, you have also mentioned that the development of large biomarker RCTs. So you are requesting for the large scale RCTs to done on it, so that there would be the low heterogeneity and you would get onto the result with more precision. So this is all about the meta-analysis. So this is we have discussed about the introduction methodology, then results, what is forest plot, how to write the discussion, what are the points in which discussion on which discussion has been hold, the pillars of discussion, important point. You can also mention the subheadings in introduction and discussion as well, how to write methodology and how to perceive it. All of the things are mentioned in these videos. Okay, so you can go through them by the time, and you can also get the answer. If there is anything, if any query, you can mention them in comment box. Okay, thank you.